I am here to present about the topic improving healthcare access with the EAC, the East Africa community. Okay. And the key points I'm going to highlight will be geared towards highlighting the features of the health sector within East Africa, but also take more time talking about dependencies that are facing us, the impact of the dependencies, and I will be giving some highlights on possible strategies that we could use to be able to overcome the dependencies. Now, looking at the regional scope, the EAC has 24 years of experience of integration. And looking at data, there are many other regions that have gone into regional integration. Growing takes learning out of mistakes, out of successes. So we want to believe with the East Africa community, with all the years, and even the first attempt that was done, we have learned, and therefore we should minimize on a number of mistakes that we might make. But now we have 8 countries that are making about 343 million people, and it is said to be the fastest growing regional economic bloc in the sub-Sahara region. Progress in the future of healthcare industry, we are seeing that towards universal health coverage, a lot of strides have been made. I will not go to those details. However, we still have challenges. But I want to mention here that there are a lot of opportunities to innovate, to invest, and to do developments within the health sector due to the growing population. As I have mentioned, our economy is growing. The high disease burden, which is not a good thing, but it means there are areas that we need to invest in. But also, much as we are different countries with different contexts, to a larger extent, we have common challenges that together we can work to resolve. Africa is home to 16% of the world's population, but 28% of the global burden of diseases is within Africa, and for sure, East Africa takes a bigger share of that. We are at a global disease burden that is talking about communicable diseases, non-communicable diseases that are increasing, but also neglected diseases, but also all that is defining life expectancy that is talking about Africa, that when a child is born today or now, you're looking at 64 years. And within our lifetime, with innovation and technology, but also the advancement that has happened in the health sector, that is not really acceptable. There are financial constraints. That 21 years since Abuja Declaration, where the African government, including the East Africa that have signed that declaration, agreed to allocate budget and spend for about 15%. But as we speak, it is only a few countries that have been able to get close to that. We are talking about high donor dependence, but also the out-of-pocket for health that is impoverishing our people. And I call it the poor man's survival dilemma, because I live in communities where someone has to dialogue overnight whether to go to the hospital when they feel ill or have a meal in a day. That is not the best place to be. Shortage of health workforce cannot be overemphasized. We have a high ratio of a service provider patient that is not really working for us, but also the high urban, rural, and underserved communities gaps that need to be looked at. A few professionals that we have in the sector are hopping from hospital to hospital. Where I work at East Africa Community, we in 2018 did a regional study. We were looking at issues of curriculums across the region. But talking to the professionals, you find one doctor moving to 4 hospitals in a day, serving in one hospital for a few hours and then moving to another one. So you think, if I'm a patient, the doctor that has come to me, after seeing 100 patients, what am I going to get out of it? But after that, we have infrastructure and equipment problems that need to be resolved. And just to emphasize that the overdependence is making us vulnerable and to shocks. If anything happens, like now COVID and other climate change happened at global level, which means at home we cannot decide where to head because there are other challenges to the donors and donor countries that are supporting us. We have fragmented and inconsistent policies because we are projectized in terms of how we program health, rather than having long-term plans, but limited local ownership of the leaders, the technocrats, but also the communities, because we are looking at somebody else to be able to support. And we really appreciate, but I know the Paris Declaration talks about local ownership, leadership, but also us being able to pull ourselves to finance more, to increasingly finance our challenges. Due to time, financing I will not emphasize, but I'm giving it as a solution, not only increasing numbers in terms of budgeting, but spending and also efficiencies that are eating even the donor money that we are getting. Inefficiencies are consuming a lot of our investments that need to be resolved. Issues of service to enhance local healthcare infrastructure. We don't have enough facilities, but if we plan better and ensure we have public-private partnerships, we can do better and reach our people. Strategies to reduce dependence would include engaging communities, better engagement of the local governments, decentralizing. I know some countries have done better in terms of budgeting together, multi-sectoral collaboration, and also promote local production. We import a lot of equipment, medical supplies, and now we are talking about local production that we need to strategically look at in terms of capacitating our private sector to produce with quality, but also ensure the prices are being seriously looked at so that people can afford the services that they look for. Regional cooperation cannot be undermined. We're here because of the regional cooperation, but together we can do better, reduce duplication, at the same time learn from each other, benchmark on what has worked in one country, and therefore move forward with better resilience. Establish robust monitoring and evaluation. We talk about owning our own solutions and solving our own problems, but we don't really have a good framework regionally to be able to monitor whether we are increasing our budget allocation, how are we spending, and consistently reduce the gaps. Finally, leadership and accountability. With peace, stability, consistent, and people-centered leadership, including partnership that work for results, we will ensure the East Africa region becomes a home where a baby born today, baby born now, will feel safe and feel that they can live to the best of their potential within their lifetime. But at the same time, anyone visiting us, either at a tour, anyone becoming a resident, does not put East Africa region on a list of insecure. When they are arriving here, when they are living here, when they are working here, coming to enjoy themselves. So health security is one of the top priority that the East Africa community should put on the list, but also back home. Health is not a liability, but an investment factor that it determines our progress and development as we move forward. Thank you very much, and I wish you the best. If there are